I think being able to create palatal stent chair side is really great. Also, with the material that you created, it helps with pain, it speeds up the healing. So this is really something that I've been enjoying using for the past few months.
My name is Shane de Vreese. I'm the founder of Elemental together with Emile. And our promise, our claim to fame is that we make palatal grafting more accessible than ever by taking care of the donor side without the need for sutures, impressions, and bringing the post-operative patient morbidity to an absolute minimum. And so the context of now 2 months ago, having achieved or obtained FDA approval, we want to enter the North American market with a bang. And then what better way than to partner with people like yourself, Professor Nguyen, and to do webinars like this to teach people how to use it in palatal grafting. Now I think it's really up to you. And thanks for doing this. I really appreciate that.
Yes, of course. Thank you for the invitation. To give a bit of context, it's a snowstorm in Canada right now. So we're supposed to do this in my clinic, but because everything is closed, I'm going to do it at home and I'll be the patient. So that will be our live demo. When you first reached out to me, I thought it was very funny because I don't know how to turn this into something that works like this. So it took some instruction, but since I start using it, I think it's very a game changer. Usually my two options is either we take an impression, we pour the impression before the surgery, then we create a splint, then the patient comes and we put the splint on. And I know I've been a bit lazy with this, so I use probably more cola tape with glue. And sometimes it works and it's great, but other times it will come off after a few days and the patient is in pain and they keep calling you back and there's nothing you can do. So you tell them like, sorry, it's just gonna take some time to heal. Able to create palatal stent chair side is really great. And also with the material that you created, it helps with pain, it speeds up the healing. So this is really something that I've been enjoying using for the past few months. I didn't know it's way harder to do it on yourself than on a patient. So I technically created the stent on myself.
Look at that.
And it works
so I think,
well. I'll be able to do this little demo today.
No, yeah. Definitely. And thanks for doing it on yourself. Suboptimal, obviously, but on the other hand, trying to look at the positive of this is, that just shows how easy it is, right? Like if you can do it on yourself, then let alone that you could do it on the patient.
Yes, of course. So, just to start the demo, the perioplast comes in a little package like this, and you'll see that it's like little beads that are there. To create a stent like this, you need all four of them. So it's not for four stents, but all this is to make one. And we also have a very nice little water bath that comes with Elemental if you get your starting kit. So with this, you have to start the water and get it to 194 Fahrenheit for it to start. So I try to preheat it, but currently we're at 140. While we wait, maybe you can tell me what's in perioplast and how does it help pain and healing?
Very good. So it's a proprietary material that we developed. It's predominantly a blend of biomedical polymers, but I think the most distinctive ingredient is zinc. So the core of our IP and the core of our technology is our ability to put zinc into polymers without them leaching. And so zinc, I think, just in general scientific literature is well documented, as described as being an antimicrobial. And so the way we leverage it is by putting it in the polymer without it leaching. You make that material bacteriostatic, but also biocompatible. And so one of the first in vitro tests we did with Professor Teugels, I think it's now 4 years ago, was to see whether biofilms grew on it. And obviously we saw a massive reduction on the ability of biofilms to proliferate on the material. But usually, and this was a very good point of Professor Teugels, when you have a mechanism, so in this case zinc, inhibiting bacterial proliferation, it often means that there's some toxicity on human cells as well, so that then the human cells don't like it either. But we actually saw an increase in the ability of keratinocytes to grow on this surface. So to come back to your question, what's inside? It's a polymer enriched with zinc. And so what does it do? How does it contribute to the wound healing? Obviously, the stent, from a mechanical point of view, is stabilizing a blood clot. Obviously that. But the presence of zinc, keeping the material cleaner, so having just less infection for the body to react to, but also being a very, very tissue-friendly material is what's going to accelerate the healing here. What a monologue.
That was great. I think just in time for it to be 194. Let me just get this out. In an Asian household, I'm using a chopstick.
Of course.
But technically, you have to use something that's sterile.
I'm happy. This is a very honest way of making the stent.
So when it comes out, it's a moldable product like this, and it's going to harden with time as it cools down. You see, I can touch it with my hand without burning myself. So this is great. When you place it in a patient's mouth, it doesn't really burn. They just feel like a very soft paste. The first thing that I tell the patient, and I usually show them the video first, is it's extremely important for them to keep their tongue to the roof of their palate. And let's say I talk too much and this sets, you can just put it back into the water bath and it will come back to be, you can mold it again. I guess I'll do what I said. I'm just going to put it down a bit.
Or if you could take out the cup, Professor Nguyen, then I think people also see like how you're heating it.
Yes.
Yeah, exactly.
So I like to keep it about maybe 2 to 1.5 millimeters in thickness. And it has to be able to not cover my whole palate, but really across the arch and go from one side to the other.
There we go. And this is where I'll take over the speaking from you a bit while you shape that. So what Professor Nguyen is doing is he placed it to the palate. He's now helping the clinician, if someone were to do it with him, by pressing your tongue to the roof of your mouth, to the palate. And at the same time, the patient's biting down. That's going to push the material over the buccal sides. And then that's when people, probably the assistant, I think, in North America, would be pressing interproximally to get extra tension. And so I would say about 1 minute is what it takes for the material to set. In a clinical setting, you could accelerate that by adding cold water. And as it sets, after about 1 minute, then you could take it out. But I think we're not there yet. What's very interesting to know is that should you mess up, which rarely happens, but if you do, you can reheat the material just like after he explained. And then also, it could be that on the alveolar mucosa, maybe on the soft palate, that there's some excess material. Just cutting the material with regular surgical instruments is also completely possible. And so I think Professor Nguyen now feels what it's setting and then getting there. Yeah, I've noticed for me now being in North America for 3 weeks and just visiting a lot of new customers here, is that it's very much the assistants who will be shaping it. So maybe after the material has set, let's talk a bit about like how it fits in the rest of the workflow. Besides making the stent, at what point you do it and how you envision that being implemented. I think we're there. Look at that.
So you see, thank you for speaking while I was doing this. This is great teamwork. So you see, now we have the stent, it's completely formed. And usually, you can trim with surgical scissors just to make sure it doesn't go all the way to the back of the throat of the patient. And also, it's not too bulky for the patient. I think I'm pretty happy with this shape because it covers most of my palate. And usually you can see that the premolar to molar area is within this area. And this is where I typically harvest from the palate. It has to be easy for the patient to put in and remove. So this is why I go a bit over the occlusal surface just to give them something to hold on to.
Look at that.
And you can put it on and remove it pretty well.
Yeah.
As you can see, usually it's a bit easier to do it on a patient than on myself. I've trained my dental assistant. So technically now what we do is even before I start the surgery or any numbing process, she would sit the patient, turn on the water bath because this is the longest process, maybe 5 minutes before the patient gets in, put it to temperature, and then she's going to do that whole process to put it in the patient's mouth, let it set. I'll remove it, I'll trim it and make sure that, it fits and it covers the area that we're looking for. And then after that, we can numb the patient and start the surgery.
Okay, cool. Yeah, I think that's very similar as to how it was originally like invented in Europe, is to do it very much before surgery.
Mm.
Maybe it's sometimes a bit more often in Europe doing the clinician, and then in North America will be the assistant. When it comes to post-operative instructions, you recommend patients to wear it up to how many days?
I think the first 2 days are the worst. So for sure, the day of the surgery, I tell them not to remove it because it's stabilized the blood clot. And of
Yeah.
course, they need to rinse it and remove it at least once a day to rinse it and clean it. So after the surgery, for the first 24 hours, I tell them to sleep with it, do not remove it. The next day, remove it, rinse it, and put it back. And try to keep it for between 2 to 5 days. I think afterwards, the healing is already pretty good. So they only need to wear it whenever they feel pain or they have anything.
Yeah.
Most of them are, you know, I don't think they would wear for 2 weeks, but they're very happy to have it. And if in case there's anything, you just tell them to wear it back. Another case that I've saw is also it helps control bleeding because usually when there's bleeding, the patient doesn't know where to put the pressure, and most of them put it in the middle. So I told them on the phone, you have your stent, put it back on, and then just put pressure on the stent, and the stent will control the bleeding.
Yeah.
And it worked pretty well this way.
Okay, that's interesting. That's a new anecdote for me, actually. I'll be borrowing that one. Say that it, you could use it almost as a remote, like for remote bleeding control. You just give them an extra tool for that they can apply themselves.
Yes, I mean, unless it's like a very severe bleeding, but any type of bleeding, if they put pressure, it will usually stop. If you don't want them to put pressure directly on where it is, or it's difficult for them to know, having a stent on protects it, and then it's easier for them to put the pressure.
Yeah, cool.
Um, Professor Nguyen, a question that comes up a lot is from other clinicians is whether patients do wear it while eating or not. Could you elaborate a bit on that?
I mean, so eating with it, I'm sure, is more difficult because it covers the occlusal surface. But at the same time, I don't want them to chew on nuts and steaks and all things like this. After the surgery, they should eat softer food. So, in the mind of having soft food, I think it is okay to eat with this. But for sure, you can't chew on something harder because it may unbalance the scent and remove it.
No,
Uh,
exactly.
yeah.
No, exactly. I think diet is affected regardless, right? Because we've got sutures in the recipient side nonetheless. So diet is going
Yes.
to be affected. But at the end of the day, they keep it while they are eating or whatever
Yes.
they are consuming substance wise afterwards. Yeah.
So,
Cool. I
So I
think
tell them,
Emil.
for the
Oh,
first 2 days, keep it all the time, and for sure when you eat, this is where it can hurt the palate.
yeah.
So this acts as a protector, but they can't eat anything hard anyway with or without the stent. So my patient usually have a soft diet for about 2 weeks.
Awesome. Before we wrap up, I think Emil, it just struck me. We promised people free shipping if they attended or watched this webinar. So I don't know how we want to drop that code. Do you have one
Let me
on
see.
hand, or am I pushing you in front of the bus right now?
Oh, I have one on hand actually.
Very
Let me
good.
just grab it and then I guess paste it in the comments would do.
Yeah. While you check that, maybe some final questions for Professor Windsor. What would be the number one? You could only choose one reason. What would be the one reason that you would recommend giving Elemental a try to appear? Is it? And I'll give you a multiple choice. Would it be for speed, ease, or cost?
I mean, I didn't need multiple choice. I would be ease or use. I mean, it could be cost also because, if you think about making a stand, the time that it takes you, the time it takes your assistant, and the material and what you charge the patient, I think at the end of the day, it's still less expensive to use Elemental. But for me, it's mainly for speed.
Yeah.
because you have something that will protect the patient, but it takes almost no time, like you can see. I give my assistant 5 minutes to set up everything and have it ready. And then we can do the surgery, place the elemental in place, control the bleeding. It's also ease of use from the patient because they can put and remove it whenever they want. And also peace of mind because then they call you less if they're not in pain. And this is also good for you.
Yeah. Awesome. So many reasons. I like that. Yeah. That's what we promise people, right? I love how you put that in the promo videos, turning this into this. And I think that's what we showed. If Uni has a shipping code, we kind of did what we promised people. And yeah, I'd probably wrap up. Well, first of all, with thanking you, Professor Wynn, to do that on a snow day in Montreal, because yeah, probably not the easiest day to do that. Thank everyone for watching as well, and we're really, really, really available whenever you want. Send us a DM, send us a message, comment here as well to answer any other questions you could have in terms of how to get started with ordering. We have a web shop where we have an intro kit, like Professor Wynn said. In your initial order of the material, if you go for the intro kit, you actually get the water bath for free. In terms of pricing, the rule of thumb is $50 for a stent. I think that's why Professor Wynn said it's a relatively cost-effective solution. And just in general, any question you might have, people, please let us know. And yeah, it's Congress season in North America and Europe, so I'm sure we'll be running into each other quite often. Next week, there's the Chicago Perio, well, actually midwinter in general, but there's a Perio event as well. It's a Europerio year. I look forward to seeing everyone there.
Yes, I'm excited for your Perio. And the AAP meeting is actually in Canada this year in Toronto.
True.
So hopefully I'll see you there.
Yeah, exactly. Oh, 100%. Most definitely.
Perfect.
Thanks a lot.
Well, thank you very much for your time. And this was great.
No, thanks for doing this, Professor Wynn. Really appreciate it. Talk to you later.
Bye bye.